Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to shed light on existing policies, projects, and programs within the health sector. In this video, we'll be discussing the Workplace HIV and TB policy for the health sector 2020. The subject of HIV and TB is one that has been associated with secrecy, stigma, pain, and ignorance. Unfortunately, the disease has a grave consequence not only on the individual but also the family and caregivers, businesses, and society at large. The first case of HIV/AIDS was detected in Ghana in 1986. Since then, all the 16 regions have reported cases. However, the data indicates an increase in the number of people living with HIV over the past decade. In 2008, the estimated number of persons living with HIV was 236,151. By 2018, the number of people living with HIV is estimated at 334,770, an increase of over 70%. By 2020, the estimated number of infected persons was 345,120, 63% of which are aware of their status and are under treatment, and 43% of which are virally suppressed. HIV infection in Ghana is strongly urban, and age group prevalence increases with age, till the peak ages of 40 to 44, despite the increase in prevalence from 1.5% to 1.67% in 2020, with prevalence within pregnant women and female sex workers being 2% and 4.6% respectively. On the other hand, the National TB Program was rebranded in 1994, following the declaration of TB as a global emergency by the World Health Organization in 1993. Reported TB cases so far have doubled since 1996 to about 15,000 in 2019. Likewise, proportions of patients successfully treated has also increased to 84%. Deaths from TB have remained at 9%. With 4.5% of all clients voting from treatment. Further analysis shows the epidemic is occurring among all age groups, with older age male 45-74 ages bearing the biggest brunt of the disease burden. TB remains the most important opportunistic infection among people living with HIV in Ghana since ART care commenced in 2003 in the public health sector. The complex relationship between HIV and TB results in a synergistic increase in their prevalence, morbidity, and mortality. The occurrence of both infections in Ghana is a great public health concern, which has prompted coordinated national response to reduce and control both infections. Although awareness of both HIV/AIDS and TB are said to be very high among the Ghanaian population, behavioral change lags far behind this awareness. The scope of the policy. This policy primarily applies to all employees of the health sector as well as prospective employees of the health sector, including those engaged with the sector but not formally employed, clients and patients. These provisions apply to both public, private, and faith-based health institutions in Ghana. Policy context. The extensive and intensive ethical, administrative, and socio-economic implications of HIV/AIDS and TB require that no one group of persons can implement a policy that will bring about the required solutions. The implication is that unless policies are aligned, they will continue to create other problems which this policy sets out to solve. Global context. The health-related Goal 3 of the United Nations Sustainable Development Goal seeks to ensure healthy life and promote well-being of all at all ages. Specifically, Target 3.3 of this goal seeks to end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne disease, and other communicable disease by 2030. The ILO Code of Practice provides a set of guidelines to address the HIV/AIDS epidemic in the world of work and within the framework of promotion of decent work. The Occupational Safety and Health Convention mandates the provision of work environment which facilitates optimal, physical, and mental health in relation to work and adaptation of work to the capabilities of workers in light of their physical and mental health. Other related global frameworks include the International Health Regulations 2005, the Astana Declaration on PHC, the AU Vision 2063, the African Health Strategy 2016 to 2030, the Africa Health Transformation Agenda 2015 to 2020, and the ECOWAS Vision 2020. National context. The following laws and national policy frameworks of the Republic of Ghana underpin this policy: the 1992 Constitution of the Republic of Ghana, the Labour Act 2003, Workmen's Compensation Act 187, Factories, Offices and Shops Act 970, Hospital Fees Act 971, Industrial Relations Act 965 amended, the Criminal Act 960, National Health Policy 2020, Universal Health Coverage Roadmap 2020 to 2030, National HIV and AIDS and STI Policy, National TB Strategy Plan.
If you've liked this video so far, make sure to give it a thumbs up and subscribe to the channel. Comment down below as well to let us know what you think, and click the card above to view the Policy Visibility Drive playlist.
The policy framework. Vision: a supportive workplace for management of employee HIV, AIDS, and TB conditions. Goal: to prevent and control HIV and TB morbidity and mortality in the health workplace. The objectives of this policy are to provide protection from discrimination and stigmatization in the workplace for people living with HIV, AIDS, and people infected with TB. To prevent HIV and TB spread among workers. To provide care, support, and counseling for those infected and affected. To promote HIV and TB education and health programs aimed at reducing the spread of HIV and TB at the workplace. Guiding principles. The health sector of Ghana acknowledges and upholds the 10 key principles of the International Labour Organization Code of Practice on HIV and AIDS at workplace. These principles are HIV/AIDS as a workplace issue, non-discrimination or stigma against workers, gender equality, promotion of a healthy work environment, social dialogue, no HIV/AIDS screening as a job application process, confidentiality, continuity of employment relationship, promotion of prevention efforts, care and support of infected workers. Implementation of the policy. The Human Resources for Health Directorate within the Ministry of Health will work together with the Policy, Planning, Budgeting, Monitoring, and Evaluation Directorate to put in place systems for needs assessment to ascertain aspects of the programs requiring strengthening, resource mobilization for specific program contents, regular monitoring of the progress of implementation of workplace programs, periodic evaluation of programs. Monitoring and evaluation. Monitoring and evaluation will be the direct responsibility of the Ministry of Health and will follow the monitoring and evaluation framework of the health sector. This shall be done based on agreed indicators quarterly, half-yearly, and annually. Identified key indicators to measure performances are to be provided by the National AIDS Control Program and the National Tuberculosis Control Program. The policy will be reviewed ex ante, midterm, and ex post. Communication and policy dissemination. Communication will form an integral part of the policy to serve as a driver to motivate and inspire everyone in the health sector to take appropriate actions in contributing towards the achievement of the shared goal. The communication approach will simultaneously be persons, staff, and system-based. In conclusion, the workplace HIV and TB policy for the health sector is essential because an increase in HIV prevalence among workers will have a long-term implication not only on the health sector, but the economy as a whole due to the youthful structure of our current workplace population.
Please note, this presentation only contains an abridgment of the policy document or publication. To access the full document or for further reading, kindly visit the service website at www.ghs.gov.gh. Thank you for your time and attention.